Hi, everybody. We're going to talk about how the pandemic is affecting people specifically who are caring for or have Parkinson's disease. I'm joined by Dr. Elena Borton. She is a movement disorders neurologist at the Hartford HealthCare Chase Family Movement Disorders Center in Mystic. Thank you so much for taking time to be with us today, Doctor.
Thank you so much for inviting me, for having me here.
And this is a special population we're talking about. Are Parkinson's disease patients at any greater risk for COVID-19?
Well, I would like to speak a bit just about our patients with Parkinson's disease. Many patients perhaps, or many people do not know what does it mean, Parkinson's disease. Parkinson is a neurodegenerative condition, is manifest by motor symptoms, non-motor symptoms. Motor symptoms are tremor, difficulties in walking, stiffness, and also decrease in fine motor movements. And non-motor movements are anxiety, depression, dizziness, orthostatic dizziness, and other non-motor features. It's very important to know that, because some of our patients who had all of these symptoms may have worsening of these symptoms just because of knowing about social distancing and isolation. Then we do not know right now if patients who had just Parkinson's disease may be more affected by coronavirus, the novel coronavirus or not. But what we know that our patients with Parkinson's disease, they are having, the age of higher incidence of Parkinson's disease are patients at risk, patients who are 60, 65 years old and older. And despite of Parkinson's disease, they may have so many other medical conditions we are calling comorbidities. And we know very well that patients who had high blood pressure, diabetes, CHF, congestive heart failure, chronic respiratory disease, all of these patients may have, and definitely we have data that they have worsening of complications and risk of developing complications from coronavirus. Then particularly, we do not know right now if Parkinson's disease patients are exposed and are having the risk of increasing complications from coronavirus.
We know people with Parkinson's, sometimes the therapies are so important, the daily routines are so important, and certainly our routines have been upended. What is your advice to your patients so they can keep going and not backslide during this time?
Yeah, it's very important for our patients to keep moving. We always ask our patients to keep moving. Guess what? During the pandemic, time is very tough for them. We always, in the last couple of weeks, we ask them to stay in the house, to try to avoid going outside, to try to avoid going in different, crowd places. Then the anxiety and stress of these patients who always have a degree of anxiety is increased right now. But we are coming and advising them, and we are coming with some programs for them. We are asking our patients to make a daily structure of their activities, to keep the structure. We are asking them to take a break from the news about coronavirus, because that can increase the anxiety. We are asking them to exercise, and it's very important for those patients to exercise in large spaces, and it's very important to exercise with their friends, with their other patients who had Parkinson's disease. But guess what? All of these facilities, gym, fitness centers, our educational programs in our family movement disorder center, they are closed. Then what we are doing, we are coming to help those patients with online programs. Our Connecticut APDA coordinator, Mrs. Susan Lather, is placing everything together to start an online program for those patients for continuation of their physical exercises, especially yoga programs, Tai Chi, boxing, dancing with patients for Parkinson's disease. All of these patients can call our center, and specifically call and ask for Mrs. Susan Lather, who is absolutely fantastic in providing information for those patients.
Just in case people don't have the number, I'm sure they can go to the Hartford HealthCare website, or is there a special number you would like Parkinson's patients to call?
Yes, we have a special number, and
We can get it for you.
unfortunately,
I don't want you to look for it,
right
doctor.
now.
Don't, we'll get it up there in the
But,
feed. Stay tuned. We'll make sure we put it in the comments. I just want to make sure people get to the right folks. Now, we know people with Parkinson's disease also, oftentimes they're fighters. And they're perhaps the silver lining. How can they help in this global fight against COVID-19?
Then those patients, you know, they are fragile. Some people are older than 60, 65, as I said. Some of them are alone. Some of them are afraid and anxious about this difficult and tough period of time. And we are asking them, please, when you are staying in isolation at home, when you are taking this social distance, please find platform, establish, try to call your friends, try to call family members, try to call us. We are there for them. We don't want patients who have Parkinson's disease to have worsening of their symptoms, and this is the reason for which we create also, and we are very avid with you know, creating this telehealth system to be close to our patients. It is very, very important to have our patient know that we are close to them, that we can listen to them, and we can take you know, their complaints, and it's important for continuation of care. This is the reason for which we started almost 2 weeks ago, maybe more, the telehealth medicine, and we are trying to advise our patients to call us. We are trying to advise our patients to keep, you know, continue calling us and have all of these visits, which are very, very important to them to continue their care and their management for Parkinson's disease. We perhaps everybody's speaking right now about telehealth system. The telehealth is defined as a combination of electronic information and telecommunication system. Was created in the past to help patients who are at distance from their specialist, or patients who need to receive an acute care. Is also created to continue education between patients and health providers, and also between health providers. It's very, very important to know that those patients have ability to see us, to contact us, and to continue their care.
I'm just going to give the phone number. It's 860-972-8100. Or you can call the toll-free hotline, which is 833-621-0600. Those are the COVID-19 hotlines that Hartford HealthCare has set up. If you go to their website also, then you'll be able to even make these virtual appointments. And though the instructions you're giving for Parkinson's patients are specific, I think it's something we can all benefit from, because what you're talking about is making sure you stay in touch, making sure you exercise, have a routine. This is something that I imagine would be very useful for everyone who's struggling with this social isolation.
Yes, yes, you're right. And I can give you an example. My parents are far, far away. They are almost 5,000 far away from me. I used to call them like every week or or twice a week. They are in social isolation right now. They are in their 80s. I'm calling them like almost every day or every other day, depending on my time. And trust me, they are happy. Why they are happy? Because I'm calling them more frequently.
Yeah.
And they started to tell me, you know, we almost like this isolation because you are calling us more frequently. And I'm asking our patients with Parkinson's disease, and not just patients with Parkinson's disease, please don't be afraid to stay far away, to stay in isolation, to keep social distancing. It's very important for you to avoid complications from this novel coronavirus. Call us if you need us. If you need any change in medication, don't go to the hospital. Stay away from the hospital. Stay away from urgent care if it's possible. We try to manage their medication and schedule of medications and explain possible complications of medications. We also have a great social worker system in our center at Chase, a family movement disorder center, and we try to help them with information, with trying to keep them, involved in different activities.
Yeah, and this is something, again, you're with Hartford HealthCare's Chase Family Movement Disorder Center. That is something that even if someone's been newly diagnosed with Parkinson's, or perhaps they have questions if they're experiencing it, they can use this telehealth system to get some guidance in that way too. Is that right?
Yeah. Yes, this is such a good question. We are not seeing just our follow-up patients. We are more than happy to see new patients rather than postponing all of these visits for a couple of months, because we have many referrals to our center. It's better to start right now to see these patients. I have to tell you that I saw many patients for the first time. They are happy to see a physician. They are happy to be referred. I'm happy to help them. Of course, examination is limited when I'm, during the video conferences or video visits, but I can have an idea and I can start doing an workup for these patients, and definitely we can start a treatment rather than having them waiting for a couple of months to see us in our office.
So a lot of questions about masks are coming in from the feeds. This is some new information that the CDC started giving guidelines. I'll just share what I know we've been reporting on the news, and if there's any extra information for your patients. Dr. Perks and Dr. Fauci have said that masks are advised if you're going to be in a situation like a store where you can't control your social distance. Dr. Fauci said over the weekend when he was interviewed, if he goes out running with his wife, he does not wear a mask. If he's alone and in fresh air, he's not wearing one. He's not wearing one in his house. I know we're getting questions about this. Do you have any advice for your patients about masks?
Well, as I said, our population, our patients are older than 60, 65, majority of them. But hey, I'm advising all of my patients to wear a mask if they need to go outside. I'm advising them to wear gloves if they need to go outside, go in grocery stores, in pharmacies, if they need to go for a different emergent test. I'm definitely advising them to wear a mask in every situation when they are going outside from the house.
What about inside the house? People are saying, do you need to wear it inside the house?
Well, this is difficult to answer, but if they are alone, it does not make sense to wear a mask in the house. If they are in the house with other family members and other family members who are, working in a health system, who are working in the hospital, and they are coming from the hospital at home, some of the healthcare, workers, providers, they auto-isolate themselves, but if they are in contact with somebody who is working in health care system, maybe it's better to wear a mask when they are around them. It's better to clean very well all of the surfaces in the house. It's a very difficult situation. I would advise them to wear a mask if somebody around them who of course is staying 6 feet far apart, start to cough or start to have a runny nose, or somebody who is working in the hospital during this period of time.
Well, it bears repeating as we wrap up our interview with you that this is a time where all of our government officials are saying it's an important next couple of weeks for Connecticut. We could turn into the next hotspot. So this is a crucial time for people to be staying home and practicing that social distancing, especially at this time. Is that right?
Unfortunately, it's right. It's very tough for everyone. And my message for my patients, I'm seeing my patients as my family members, as my parents. Stay in the house, isolate yourself, don't go outside if you don't really need it. It's better to stay far away from the hospital. If you don't have any severe emergency, call us, continue the care with us by telemedicine. We saw that by telemedicine we decrease the patient presentation to emergency room and to the hospital. Then, if possible, please don't go to the hospital if you don't have an emergent situation.
Absolutely.
Call us and discuss with us. Call your primary care physician. try to keep right now, in the next couple of weeks, it's very important to keep social distancing and isolate how much possible.
As much as possible. Thank you, Dr. Elena Borton, for being with us. And I know that people can go back and find that phone number that we announced. And that way, if people have questions, to keep in contact with Hartford HealthCare via the COVID-19 hotline and the telehealth that's available. Thank you so much for being with us.
Thank you so much for inviting me. Take care.
You too.